Hi and Assalamualaikum. My name is Nur Sabrina binti Abdullah. In this video, my team member and I will explain about the modality of the mammography. So, let's get started. First of all, I will introduce about mammography modality. Developed in the MIT310 country, mammography is a correct to detect early sign of the breast cancer by capturing detailed image of the breast tissue. It is a non-invasive procedure and one of the specialized imaging techniques that use a low dose of radiation. It had identified abnormalities like lump and micro classification before symptoms appear. You guys might think that mammography is only for women, right? Actually, men also can do it, but if necessary, but usually in very small quantity. Because we didn't have a chance to do this procedure, so I will show another video that I got from another sources about how this procedure is done. Let's move on.
A mammogram is a picture of your breast taken with a safe, low-dose X-ray machine. Your technologist will ask you to stand facing the mammography machine and then place one breast at a time on a flat surface. Another flat surface, called a compression paddle, will gently be lowered into place to compress your breast. Compression is necessary to spread out the breast tissue and to eliminate motion, which may blur the image. The compression may be uncomfortable, but shouldn't hurt. Compression usually lasts no more than 20 to 30 seconds. During this time, an X-ray beam comes from above and penetrates your breast tissue. The X-ray image is either created on a film cassette, located below your breast, or recorded digitally and stored in a computer. Denser breast tissue, such as cancer or calcifications, appears bright and white, whereas less dense tissue, such as fat, appears dark or gray. After the X-ray is complete, the compression will release and the technologist will change the angle of the machine. Again, position your breast on the flat surface, gently lower the compression paddle, and take one more X-ray. Following the procedure, the images are processed and made available for review and interpretation by your doctor.
Assalamualaikum, I am Nurul Ijati and next I'm going to present about the principle of mammography. Mammography has a low subject contrast. The breast tissue, which is fat and muscle, have almost similar mass density and atomic numbers. Therefore, there are a few basic principles in mammography to address this challenge. First, low dose of X-ray. The mammography uses low energy X-ray, typically 20 to 30 keV, to maximize the contrast between different breast tissue, which is fatty and glandular tissue, while minimize the radiation exposure. This is why fatty tissue areas look darker on image, and denser areas like glandular and tumor stand out appear lighter on the image. Secondly, compression of the breast. The breast is compressed between two plates to spread the tissue evenly, to minimize the motion artifacts, to reduce the tissue overlap, thus enhance the visibility of abnormalities in the breast tissue, and lower the radiation dose by reduce the thickness of the tissue. Although compression might feel uncomfortable, it's crucial to spread the tissue evenly for clear image and to reduce the radiation dose. Third, specialized equipment. The equipment is specially designed, so it must be able to enhance the differential absorption in breast tissue due to similar mass density in the breast. There are a few examples of aspect in the equipment, which is must use molybdenum or rhodium anodes for precise X-ray energy. The grid is to reduce the scattered radiation and to enhance the contrast. And small focal spot is used to capture fine details like microcalcification. Next is radiation safety. The radiation dose given to the patient should be kept as low as reasonably achievable since it involves radiosensitive organ. Therefore, mammography follows the LRR principle to optimize the X-ray setting so it can ensure safety without compromising image quality.
So next, I will show the basic component of this modality. First of all, at the left side, you guys can see the computer screen. It's called control panel. So the function is to monitor the image, set up the exposure time, which is kVp and MS, and also place where imaging quality can quickly be accessed. At the right side is the tool that direct with the patient. So we start with a generator. The generator function is to provide power supply and control the exposure parameters such as voltage, current, and exposure time. Next is foot pedal to control breast compression, positioning, and alignment of the detector unit. While the detector is used to capture X-ray image of the breast tissue and convert radiation into the digital signal to detect abnormalities. And then the X-ray tube, with function to generate low energy of X-ray directed at the breast tube to create the detailed image. And the last one is compression device, which is adjustable device to compress the breast of the patient for reduced motion artifact, minimize superimposed tissue, and decrease radiation dose to get clear image.
Next, I'm going to present about image acquisition. Image acquisition involves several key steps to ensure high-quality image while minimize the radiation exposure. First, patient preparation. The patient is asked to remove any jewelry, clothing or objects that might interfere with the imaging, and then patient is positioned to ensure proper imaging of the entire breast, including tissue near the chest wall and the axilla. And then the breast is carefully adjusted and compressed using a clear plastic paddle. Next, standard X-ray imaging. The low dose of X-ray pass through the compressed breast. There are two standard images are taken for each breast. First, cranial-caudal view, which capture a top to bottom image, and then mediolateral oblique MLO view, which capture an angle side view to include tissue from the upper outer breast and armpit region. After compression, the X-ray tube emits radiation through the breast. Tissue density absorbs X-ray differently, creating contrast in the image. Next, for imaging processing, digital mammography system allow the adjustment of brightness, contrast, and the other algorithm of the image that can enhance the visualization of dense breast tissue. Advanced technology, such as tomosynthesis or 3D mammography, takes multiple images at different angles. It is to produce detailed slice of breast tissue, which can reduce issue with overlapping structure in dense breast. Next, for image review, specialized software like computer-aided detection (CAD) is used to identify abnormalities such as mass or calcification. Finally, the images are stored in a picture archiving and communication system (PACS), where image can easily be kept, accessed, and transferred digital for future reference.
Assalamualaikum everyone. My name is Adriana Safia, and I will continue to discuss about clinical applications of mammography. The clinical applications of mammography are vast, making it a cornerstone in breast imaging. Its most notable applications is the early detections of breast cancer, which is crucial for improving treatment outcomes and survival rate. Mammography is also highly effective in differentiation between benign and malignant masses, helping clinicians decide on the appropriate course of action. For individuals at high risk of developing breast cancer, such as those with a strong family history or genetic predispositions, mammography is used for regular monitoring to detect changes over time. It is also invaluable in assessing abnormalities such as palpable lumps, unexplained nipple discharge, or skin changes like dimpling, which could indicate underlying issues. And lastly, mammography serves as a guide for biopsies by pinpointing the exact locations of suspicious finding, ensuring accurate sampling for further.
Latest technology for these modalities is digital breast tomosynthesis (DBT), also known as 3D mammography. It's an advanced imaging technique that improves breast cancer detection. It works by taking multiple X-ray images of breast from various angles, which are then reconstructed into a series of detailed slices. These slides allow radiologists to check the breast tissue layer by layer and reduce the overlap of dense tissue that can hide tumor in the traditional 2D mammography. DBT enhances the visibility of small cancer, reduce false positive, and provide clear image, especially for women with dense breast tissue. It has been shown to improve detection rate and reduce the need for additional testing. So you guys can see the video at the right side show how DBT works.
For advantages of mammography, mammography has several advantages that make it preferred diagnostic tool in breast imaging. First and foremost, it is highly effective in detecting breast cancer early, often before physical symptoms appear. Early detection is key to improving prognosis and increasing the likelihood of successful treatment. Another significant advantage is that mammography is non-invasive and widely accessible, making it easy for many people to undergo regular screening. It can also identify several type microcalcifications, which are tiny calcium deposits that may indicate the presence of cancer or other abnormalities. This ability to detect even the smallest masses sets mammography apart as a highly sensitive imaging technique. Furthermore, by facilitating early diagnosis, mammography has been shown to reduce breast cancer mortality rate. It is a standardized procedure, meaning it is reliable and consistent with a high level of diagnostic accuracy when performed by trained professionals. Despite its numerous advantages, mammography does have certain limitations. One major challenge is its limited sensitivity in dense breast tissue, which is more common in younger women. Dense tissue can mask abnormalities, making it harder to detect small lesions. Although the radiation dose used in mammography is minimal and considered safe, there is still a small amount of exposure which raises concern, particularly for repeated use. Additionally, mammography has a risk of producing false positives, where abnormalities that are not cancerous may lead to unnecessary anxiety, further tests, or biopsies. On the other hand, there is also the possibility of false negatives, where cancer may not be detected, especially in certain types of tumors. This could delay diagnosis and treatment. And finally, mammography cannot always provide definitive answer for the nature of lesion. In such cases, complement any imaging modalities like ultrasound or MRI may be required to provide additional information.